antisepsis of the patient's urethra, the uninflamed urethra. It has been amply proven that, though the posterior urethra is sterile, the normal anterior urethra may harbor quite an indefinite number and variety of pathogenic microorganisms. But on account of the mechanical cleansing of the urinary stream, these are almost exclusively confined to the balanitic portion of the canal. Yet it is not unusual to find bacteria in the bulb of the uninflamed urethra, though it is most unusual not to find them in the terminal inch, page 166. Moreover, the preputial cavity swarms with bacteria. Hence has arisen the practice of washing the glans penis and flushing the terminal inch of the urethra with boric acid solution before introducing any instrument. Though such washing and flushing is scarcely more effective than that of the urinary stream, and might therefore be omitted, except in case the danger of infection is unusually great, i.e., in cystoscopy, catheterism for aseptic retention, and tying in an indwelling catheter, perfect technique requires that this washing and flushing always precede introduction of urethral instruments of whatever description. The inflamed urethra. When the urethra is acutely inflamed, the passage of instruments is permissible only for the cure of that inflammation or for the relief of retention of urine. In either event, the mechanical damage done by any added manipulations outweighs their virtue. No special effort should therefore be made to clean the canal. The glans and meatus should be well washed. Chronic urethritis is no bar to the passage of instruments. These may be used either for the treatment of urethritis or for the diagnosis or treatment of coexisting conditions. In the former case, the instrumentation, catheterism, habitually carries with it its own antisepsis, injection. In the latter event, passage of sound, cystoscope, etc., not only may this instrumentation not directly imply antisepsis, but it may directly imply considerable trauma to an infected canal. Therefore, it is necessary to precede the instrumentation by a soap and water and bichlorid wash of the glands and adjoining tissues, and a thorough irrigation of the meatus, and even, in some cases, of the whole urethra, with silver nitrate 1 to 4,000 or oxycyanide of mercury 1 to 4,000. But the urologist must not confide too much in what is at best but a superficial and incomplete antisepsis of the anterior urethra. The danger of infection is far more closely related to clumsiness or roughness in passing the instrument than to preliminary urethral antisepsis. Every surgical operation must be cleanly, but every urethral manipulation must also, and above all, be gentle. The dangers of urethral instrumentation are local, exacerbation of urethritis, prostatic or periurethral abscess, and chiefly to be avoided by discretion in the choice of and gentleness in the passage of the instrument, or general, urethral chill, systemic gonorrhea, urinary septicemia, and chiefly to be avoided by antisepsis, to a less degree by gentleness. This antisepsis, of which the principles and practice are discussed in Chapter 37, consists in hexamethylenamine before, gentleness during, and local antisepsis after instrumentation. The hexamethylenamine may often be omitted with impunity, and since it implies administration of the drug for 48 hours before instrumentation, it is often neglected. But there is no excuse for neglecting to be gentle or for omitting some form of antisepsis after instrumentation. Even when the temper of the urethra is well known, the omission of a post-instrumental antisepsis may unexpectedly excite a sharp chill. The usual post-instrumental antisepsis consists of an installation of nitrate of silver or an irrigation with some silver salt or with permanganate of potassium.